Welcome once again, friend. On the most commonly repeated one-liners ENT, today we will be discussing the part 6 of the continuum. I am Dr. Naren Singh Chauhan. So, beginning with the first question. Today, our first question says, call oral fistula is. Call oral fistula. It is very rarely asked, but is very important question as a part of ENT associated with the embryological anomalies, that it is the first brachial cleft anomaly. It is related to first brachial cleft. This is the anterior most part of the first brachial cleft which connects external auditory canal to the neck. It persists even after the birth. Means the first brachial cleft, the anterior part which connect the external auditory canal to neck. External auditory canal to neck, it persists, which leads to the call oral fistula. Its internal opening is in the external auditory canal, whereas the external opening is at the angle of mandible, in between the angle of mandible and sternocleidomastoid muscle. Sometimes it gets infected, leading to the discharge. Then the surgical correction is the only option. So we have to keep in mind, call oral fistula is a first brachial cleft anomaly with its external opening at the angle of mandible and sternocleidomastoid in between. Now the second question. The second question says, inner ear is present in which bone? It is a direct question which asked inner ear is present in which bone. So inner ear, as we know, is a part of temporal bone. So if we sub-specify it, that is the petrous part of temporal bone, inner ear's exact location. Crus commune. Now we are talking about the crus commune is a part of semicircular canal. So what actually the crus commune is? We know there are 3 semicircular canals which opens into the utricle through 5 openings. If we think each semicircular canal has 2 openings, then why of 6 opening there are only 5 openings? The reason behind is that 2 openings of the posterior and superior semicircular canal fuse together to form a single opening that is known as the crus commune. That is called as crus commune. Then it opens into the utricle. So this is the importance of crus commune, and it is related to semicircular canal, specifically if you say posterior and superior semicircular canal. Now question number 4. Question number 4 is also a direct question which says horizontal semicircular canal responds to. So we know that semicircular canals are related to the rotational movement. So horizontal semicircular canal responds to the rotational movement of body. Question number 5, it says that endolymphatic duct connects. So endolymphatic duct connects utriculosecular duct to endolymphatic sac. Endolymphatic sac which connects to utriculosecular duct, that duct is known as our endolymphatic duct. Moving on to the question number 6. Question number 6 asks about the dehiscence in the external auditory canal. We have to keep in mind this dehiscence is in the external auditory canal, cause infection in the parotid gland. So what is the mode through the pathway through which the infection travels interchangeably either from parotid to external auditory canal or external auditory canal to the parotid. That communication is called as fissure of Santorini. Fissure of Santorini are the deficiencies in the anterior-inferior. These are the deficiencies in which part? Anterior-inferior part of the cartilaginous part of external auditory canal. This through which the external auditory canal communicates with the parotid, and this is a interchangeable by-way communication. If any infection of parotid can travel to external auditory canal, and the infection of external auditory canal can travel to parotid through the fissure of Santorini. So the second question which can be asked regarding to fissure of Santorini is that in which part, that is in the cartilaginous part of the external auditory canal, that is also in the anterior-inferior part. Now, question number 7. Question number 7 says, pars flaccida of tympanic membrane is called as. So, this is a direct question. We have to learn it. That pars flaccida of tympanic membrane is known as Sharpnell's membrane. This is called as Sharpnell's membrane. So, this is direct question. Carcinoma base of tongue is referred to ear. That is, carcinoma base of tongue pain is referred to ear through which nerve? So this is a case of referred otalgia, and the nerve responsible here is our glossopharyngeal nerve. Which nerve? Glossopharyngeal nerve. Question number 9, which says that promontory which is seen in the middle ear. The promontory which is seen in the middle ear is formed by the basal turn of cochlea. Which turn? In our case, this is the basal turn of cochlea. Now our last question. This is very important question. So that's why we have included in this our part 6. It says processus cochleariformis is related to which tendon? That is tendon of tensor tympani. Now we have to discuss this processus cochleariformis. This processus cochleariformis is a hook-like structure. Which like? Hook-like structure. This is a hook-like structure present on the anterior superiorly on the medial wall of middle ear. Yeah, medial wall of middle ear. So second question which can be asked in context to processus cochleariformis is, it is present on the medial wall of middle ear, where anterior superiorly. The tendon of tensor tympani hooks around it. It take a turn around. The second clinical significance of processus cochleariformis is that it acts as a landmark. It acts as a landmark for the first genu of the facial nerve. First genu of the facial nerve. It is present above the processus cochleariformis. So total we have 3 questions out of processus cochleariformis. So it becomes a very important topic in NEETPG preparation, that it is related to the tensor tympani tendon because it takes a turn through the processus cochleariformis. Second, the processus cochleariformis is present in context to the medial wall of the middle ear. Third question is, it acts as a landmark for the first genu of the facial nerve. With this, we finish the 6th part of the most importantly asked MCQs in NEETPG exams is from the ENT portion. So if you like this video, to be in touch, kindly share and subscribe, and stay tuned because much more parts are on the way. Thank you.